Hey friends, hope everyone is doing well. I am giving another update on me. If you are just joining in, my name is Rebecca, and I have been battling and beating stage 3 breast cancer. And I have recently completed chemo and all of the fun things that go along with that. And I had a bilateral mastectomy on July 18th. And I am kind of given the rundown on how all of that went since then, since the bilateral. I've mentioned on my last video, it's funny because I've lost all my hair, so I shouldn't be shedding, but when you have golden retrievers and cats, you get animal hair on you. Anyways, a squirrel. All right, so the last video that I did, I mentioned that I had possible complications from my bilateral mastectomy, and that we had been talking about doing another procedure or surgery, and that's where we are today. I'm kind of giving an update on that. So I mentioned that at my several appointments after my mastectomy, there had been some concern about my skin healing and necrosis and all of that fun stuff and what that would mean. So last Monday, I went in, and I had already been kind of told that there was a decision that was going to be made last Monday about how to handle it, if it was going to get better or if it wasn't. I went in, and my nurse practitioner looked at me and immediately said, okay, so we're scheduling you for surgery, like full-on surgery for Wednesday. And that's what, that was what the plan was. We were going to go in, and they were going to remove all of the skin that was bad, and they were going to remove my expanders and put new expanders in. So that was scheduled for last Wednesday, which was the 18th of August. Today is the 19th of August. So Wednesday comes, and I go in. My surgery was scheduled for like 4 o'clock. I was supposed to be there. I'm sorry. No. My surgery was scheduled for 1 o'clock. I was supposed to be there at 11. So we get there probably like 10:30, 11, like we're supposed to, and they take me back. Again, my surgery didn't actually start until after 4. It was after 4. So I didn't really, the thing was, what we were being told at that time was that the operating room that we were supposed to use, there was someone in there, and their surgery was taking longer than anticipated. And, that is fine. I wouldn't want a surgeon rushing on my surgery at all. So I get that somebody else was in surgery and it took a long time. I probably didn't go back for 3.5 hours after my surgery was supposed to be scheduled, which is not fun when you can't eat or anything like that before surgery. But we understood. I guess my surgeon got called into another surgery during that waiting period, and then we had to wait for her to get done with that surgery. I don't know. It was kind of chaotic trying to get through that day. Also, during that day, my husband, who was at the hospital with me, got called away because one of our daughters got sick and had to go get her from school and take her to the doctor. And, it was just one of those days where if it could happen, man, and that is just one of those days. Otherwise, surgery from my standpoint, it went well. Um, I woke up in recovery. It was kind of funny because I remember going into my mastectomy and talking to the anesthesiologist team, and the same anesthesiologist team rolled me back into the OR this time, and they remembered me. They remembered saying that one of the things that she said to me right before I went to sleep was, "We remember you from your mastectomy because you have 3 kids and you have a son named Henry and he's 17 months old." And she goes, "We cheered in the OR when we got your initial pathology reports back because we were so excited for you." And this, man, when you get sick, your emotions like get all over the place. So anyways, so that is something that I remember from the anesthesiologist team before I went down for the second time, because they remembered me and my family, and they were cheerful for me. And, little things like that makes a big difference, because not everybody in your treatment team makes you feel like that. I mean, I'll be honest, my plastic surgeon does not make me feel like that. She came in and marked me up and left probably at like 12:30, and I've never seen her again since then. I mean, she went, obviously she did my surgery, but she doesn't like come in and talk to you. And that bothers me a little bit. I think I've mentioned that before. That is something that bothers me. Anyways, but the anesthesiologist team, like they were very nice, and I was very appreciative of them. After I woke up from surgery, I was in the PACU, I guess, and it was, okay. I was sore, I was drugged up and all that kind of stuff, but it was pretty uneventful. My parents were there. Obviously, my husband was taking care of our kids and trying to figure that stuff out. I went and stayed with my parents that night, and I came home the following day, which was Thursday. And my recovery since then has been okay. Like, it hasn't been terrible. I was very disappointed because I did come out of surgery with 2 more drains, and I cannot stand the drains. They're very uncomfortable, especially where they put them this time, like kind of in my rib cage, like right underneath where my boobs were, and like kind of near the incision site underneath. And so they're uncomfortable. You can't really turn or move, and then you have to, I'm kind of just complaining about it because it's not fun. It's necessary, but not fun. Where my mastectomy kind of put me down for a couple of weeks, this has not as much. I'm very sore. I probably, I had a ribbon cutting I had to be at and give a speech on Friday. So that was less than 48 hours after my surgery. And I was determined to do that because it was years in the making, and I did manage to make that. It was exhausting just being out of that house for an hour and a half, but it was okay. I made it through, and then the rest of the weekend, I really just kind of relaxed and didn't do much. One of the things that did happen, and I'll kind of touch on it in a minute, was we did get some MyChart information, which was kind of stressful. So today was my first post-op appointment with my nurse practitioner that's been seeing me since all of this has happened, except for that one time the PA came in, but we really like the nurse practitioner. She came in, and I was able to have my drains removed today, so that was great. She looked at my incisions and all of that and said that they look great. I don't have to really bandage them up like before. I was having to bandage, my husband or my mom was having to bandage me up. with things to try to help it heal. I don't have to do that now, so that's good. I can take a shower tomorrow, which will be great. And that, she said all that looked good. She also filled me. So one of the things that happened in the surgery, and I did go and read the surgical notes. I did have more fluid in my left side than my right side, which was the non-cancer side versus the cancer side. They removed a large amount of skin, and they had to replace the expanders with smaller expanders. And they had to pull it pretty tight. And I could feel like the tightness. And this time, whereas I came out of my mastectomy and I had a little bit of like shape, I guess, because they filled those expanders with air in surgery. When I came out of surgery this time, I mean, I was pretty flat. And noticeably, it was a noticeably different size. And for someone who had triple D boobs, not to have any, like, you can definitely tell that. And so I noticed that difference. And honestly, there's parts of that bothers me and parts of it that doesn't. I mean, I just want to be healthy at the end of the day. And the grass is always greener, I guess, when it comes to things like that. But anyway, so that's what the surgical notes, like, I knew that she had changed the expanders out. I knew that there had been fluid in there. And, I knew that. So anyways, during our appointment today, they looked at them and they were like, okay, we're going to fill you. So they did fill me a little bit. One of the other things that I had noticed last night or yesterday on my chart, and I was kind of waiting for her to say something about it, and she didn't, and my husband said something about it, was that they did cultures during my surgery. So they took out some breast tissue, I guess, and they took out other tissue or specimens. And anyways, those specimens came back and they were positive for staphylococcus or whatever, however you say that word. And there were a couple of different tests that came back. They were all abnormal, like a scant growth of whatever it is. But that's been something that she's mentioned is like a major concern. And one of the reasons why she didn't do fills during the last appointments when my skin wasn't healing, because if there was something, she didn't want to expose anything else into my system and all of that. So we brought the pathology results up to her, and she hadn't seen them yet. So she pulls them up and her face gets serious again, and she's like, okay, well, actually this is positive. This could be a concern, but I'm looking at this. It's MSSA, it's not MRSA. The cultures were taken before the surgery, so she's thinking that the surgeon had washed everything out and has changed everything out. So whatever they got there, it might not even be on there. It might just be the skin that was on the outside. She was going to talk to the surgeon and ask her about it, which, I mentioned, like, I haven't talked to my surgeon. I haven't seen my surgeon. That is frustrating to go in and have this conversation, and the surgeon, the person that was there, isn't even in the room. You haven't heard anything about it, and it could be serious. That's frustrating to me. That's something that I'll remember. When I'm looking back at this experience, and if I would recommend someone, my nurse practitioner is fantastic. If she wasn't, this would be a terrible situation to be in. But she's also not my surgeon. She's not in there. So when you have questions like this, it's frustrating. And that's the problem that we have with our system. And I don't know, that's a problem that I have with this system. So, anyways, she made it seem, the nurse practitioner made it seem like, okay, it's good we know about this. I'm already on antibiotics. But she said, she goes, Rebecca, the thing is, if this becomes an infection, antibiotics aren't going to fix it. So, it's good that you're on that and everything. She goes, but if this becomes if this becomes a problem, then we're just going to have to explant, take the expanders out, close you up. You're going to need to finish your cancer treatments, and then you come back when you're all done for reconstruction. And, that's frustrating. Hopefully that doesn't happen. I feel like everything that could happen is happening, so I'm just trying to get my mind around that. Hopefully it doesn't. Hopefully, I don't have a fever. I don't have any redness or anything. If we hadn't brought the results up to her, she wouldn't have known any better, and everything looked fine because she had already said in that appointment, look, that everything is going to be moved quickly from here on out. You're going to come back every week. We're going to do fills. You're going to make sure everything's healed. And, this part of the process won't take very long. Now we have to be watching out to make sure I don't get some kind of crazy staph infection. And, that's frustrating a little bit. I am encouraged that everything looks good right now. So hopefully everything stays good, but it's going to be in the back of my mind. So hopefully everything will look good. What I will say is I do have another infusion tomorrow. That was a big concern last week when I went in on the Monday and they were making decisions to have surgery on Wednesday, because I've said, look, I don't want anything to come in between my infusions. And I have an infusion scheduled on Tuesday. We kind of went back and forth. There was a brief minute where the conversation was, well, maybe we push back your infusion. I was like, look, I don't think y'all understand. My infusion is more important than my boobs, or any kind of reconstruction. So I'm not pushing it back. If you think that it will push it back, then we'll do this afterwards, which, to be fair to them, if with necrotic skin and all that kind of stuff, you got to get rid of it. I get that, but I've already had my infusions pushed back. I've already done my reloading dose again. I just want this. I don't want any more delays. That doesn't mean that it's not going to happen. But long story short, I did talk to my oncologist. I am good to go for my infusion tomorrow. So it's my second just HP infusion, Herceptin and Perjeta. Hopefully, it'll be like last time where there's not any crazy side effects. I had, some stomach issues for a couple of days afterwards, but nothing like the chemo, nothing that would make me put my life on hold again. So that's good. So as of right now, I have that appointment scheduled. I am going to have to reach out to the lymphedema folks and get that appointment done. I did find out from my surgeon right before surgery, because we asked about that, about when I should, when I could go and see the lymphedema clinic to just try to prevent anything from happening. And she said 2 weeks after surgery. So I'm going to try to schedule an appointment for late next week if possible, but we'll see. And then, hopefully I'll start, kind of pulling myself together and be able to start driving and get back to work here in the next week or two. That's what I'm hoping for. I'm still sore, still not sleeping that great because I'm sleeping sitting up. Hopefully now, that my drains are out, later this week, it'll get better. But it's starting to move, hopefully, in the right direction again, where we can get into a routine. That's what I'm praying for. it's exhausting. If you're going through all of this, it is exhausting, and I think you would know what I'm saying. I have had people comment on my videos, and I appreciate it so much, because some people just say, "Hey, look, this is normal. It's normal," or "You're normal to feel this way," and I appreciate that. Or give suggestions of other things. So I am reading them. If I'm not commenting on them, I am reading them, and I appreciate it. I noticed this when I was watching my last video back to see about my hair. My hair is starting to grow back. It has like weird little like long things. It's darker than what I'm used to. It feels weird right now. So that's fun. My husband today asked if I wanted him to like trim it. I was like, no, I don't want you to cut it. I don't ever want to cut my hair ever again. Which I know I'll probably have to do. I don't know. But if your hair is growing, let me know what you're doing to make it grow faster, and if you're trimming it or how it looks coming in. It's so hot that I can't really wear my wigs because it just is so hot. It makes me claustrophobic. Even wearing a hat sometimes makes me claustrophobic, and I've started getting used to not wearing it. And I've been out in public a few times at some things where there's a lot of people, and I haven't had a hat on or a wig on, and so I'm getting a little bit more comfortable with that. But I still like do a double take every time I see myself in the mirror. There's just like nothing that I really recognize about myself, but it's okay. All right. Well, that's this update. I have my infusion. I'll give an update on how that goes and how my next plastic surgery appointment goes. But thanks for watching and for all the support and all the prayers. That's really what has gotten me to this point. So I appreciate it very much. And I hope you have a great day. All right. Bye.